sum up the last year in a sentence or two? What has that been like?
In a sentence or two.
Oh my gosh, it was so sudden, when everything just shut down.
We were having our national convention down in Biloxi, with a pit stop in New Orleans. You know how we do it. And by the time I flew back on March 1st, it was real.
I used to work as a medical surgical nurse, and we were just told we were now going to be a COVID unit. We didn't have an option, so that was a shock.
No textbook, no nursing course, no nursing instructor ever prepared me for this.
It was very stressful because we didn't have enough supplies.
There was the PPE shortage.
We're like, we're nurses. Why are we wearing cloth masks? We need surgical masks. We need N95s. We need, gloves. We need all of these things, face shields. We need these things.
It came to a point where I would see some of my coworkers stapling their face masks because we didn't have enough.
I had to take care of patients, so whether or not we had the right equipment or protection, I was still gonna do my job. And so it was scary to know that because I am there to take care of people, I might get sick.
We're caretakers to a fault sometimes,
It took a while. We had no idea that we would need PPE as badly as we did. We weren't prepared.
9 or 10 months later, we're still reusing those masks. And the masks are designed for single use. We're using them for an entire day and then saving them, getting them cleaned and reprocessed, and then 6 days total.
It's scary.
Patients are dying, real people are dying.
It blows my mind to go into work every single day now and see numerous people with COVID. In the beginning, I would maybe see a patient here and there that had it or had symptoms, and now it's every single day, so.
I'm a single mom. I've seen friends die. It's scary. If I get this COVID, what happens to my kids?
I have 3 Black children, 2 Black boys. I worry about when I'm not here, what is this world going to be like? Because although there's been so much injustice in the past, I just always still had the idea that we were moving forward. And the reality that we really haven't moved as far along as I had thought has just really affected me in ways I can't even really fully express.
Nurses don't cry, we're tough.
They need help. People need help. People have a struggle right now just actually getting medical care.
Who else better to step up in a healthcare crisis, but nurses?
The media was like, healthcare workers will get tested first. No.
The political aspect interfered tremendously.
As an employee full-time, I have never been COVID tested through work. Not once. It just is frustrating to see where those resources actually get allocated to.
All of the testing sites that were provided across the state, there were drive-throughs, very little walk-ups, but most of the underserved don't have automobiles. So if you didn't have a car and you lived across the street, you could not be tested because there was no walk-ups.
Part of what we are confronted with is the fact that in many people, in many communities, they don't trust the medical profession.
For years, you just go, oh, CDC said it, it's golden. I lived in Atlanta for 28 years, it's drove past it, for years. But I never imagined that medicine would be politicized. And so one of the main sources, became questionable.
We have to be trustworthy, we have to be honest, we have to share, and we have to be vulnerable in the sense of sharing what we know and what we don't know. And there are times where we don't know stuff.
Things change every day, sometimes multiple times a day. You have to figure out what policy or procedure has changed and which ones are staying the same.
I work in a heart and vascular center or cardiology. A lot of people kind of had complications to their illnesses, and we couldn't do anything about it. A lot of them were refusing to come in or too scared to come in.
To expect for them to understand and we don't even understand. You know, it's tough. It's tough.
It takes a lot more time to take care of a patient with COVID isolation. To limit the amount of people being exposed to the virus, it puts a whole lot more on those nurses.
We're not as fast as a smartphone. We're still humans. We still have processes and errors, and things take time. You're not gonna get better in 2.5 seconds. You gotta work with us.
Part of what makes me feel happy is the fact that I work with people that get it. I work with people that get it.
Everybody is positive, upbeat. They do like a challenge. They're very smart. They're great at problem solving. And I don't think without loving challenge and problem solving that we could have done as well as we have.
We're like firefighters, you know, COVID testing. You need testing? We'll be right in there, you know, mask, shield, you know, we got you.
I'm right now working 13 out of 15 days. So today is shift 12. On Saturday, I'm doing COVID swabbing, and that's just extra.
There are many healthcare workers that are, you know, risking their lives out there to save these patients, and you know, they don't even get to have family time.
I don't really get to see my family right now, so my coworkers have become my family right now.
I haven't seen my family. They're 2,000 miles away. The holidays were tough.
I know it's hard for people to be alone and to not be around people. I'm struggling with that too. It's lonely.
Just to hug my mom, my aunts, my cousins. Because I miss them so much.
My daughter is high risk. Her wanting to go to school and to be with her friends, you know, as a father, you know, you kind of want to do anything to make your child happy, especially your daughter, you know, that's your princess. To be honest, like, we don't really have the answer. We just kind of understand, which she just kind of understood that she couldn't go to school. We just understand that we have to wear masks and we have to distance ourselves from people, and this is the new norm. We just kind of have to understand.
When you see people fighting that they don't want to put on the mask, so as nurses, we're like, it's not fair, because when you get sick, then you come and you expect us to take care of you, right? And we don't have no choice, because, you know, we are in a caring profession, but it's frustrating when you feel like saying, okay, if you don't want to put the mask on, when you get sick, don't come to the hospital then, right? But we can't say that. So that's the frustrating part of the whole situation here.
As a public health person, it's my responsibility to try to do what we're doing right now, which is to talk to you and to say, we have to work together. We got to work together to make this thing happen. And if it's all about you, if it's all about me, it's not going to work. But it's got to be about us. And I think that when we get to the point where it's about us, then we will start to see a difference.
People need to set aside this politics and for once think about the other people that are suffering out there.